Dr. Brad Willingham is the director of the Multiple Sclerosis Research Program at the Shepherd Center in Atlanta. And because his background bridges basic neuromuscular physiology and hands-on clinical exercise science, Dr. Willingham thinks a lot about what I'll call translation-ready tech, making sure complex tools actually work for both the patient at home and the therapist at the point of care. It's always good to see you, Dr. Willingham.
Thanks for having me.
One of the challenges in remote monitoring is transforming a mountain of continuous sensor data into something a clinician can actually use in real time without causing alarm fatigue. How can AI help bridge the gap between passive wearable data like gait or sleep metrics and the clinician's active decision-making process in the midst of a chaotic day in a clinic?
Yeah, you said it. Arguably, one of the greatest challenges in contemporary medicine and biomedical research is to extract meaning from all the data we now have access to. Every day, there's a new device generating new streams of data, and the resolution is getting greater and greater. Continuous data streams, millions of data points coming in. How do we make sense of it? How do we extract data from that? Well, fortunately, that's exactly what AI is good at, and specifically generative AI, large language model technology, excels at ingesting large amounts of information, very different sources, and assimilating it, synthesizing it, and summarizing it. And so by applying that to monitoring data sources in the clinic, we can now realize the full potential of these technologies, because they're giving us unprecedented insight into needs, progress, abilities of patients. But how do we realize that potential? We need some help synthesizing it. That's what AI can do. So if you think about converting millions of data points into brief, succinct paragraph of what a clinician needs to do, then we have a way to integrate it.
So that AI tool, if you will, is sort of serving as middleware between the millions of data points and that one succinct paragraph.
Absolutely. The key to that is informing the middleware with clinical perspective, patient perspective. And so when you think about translating innovation into impact, it's critical to engage patients and clinicians early and often so that we can design system prompts or tailored AI so that the summaries that it's generating and the synthesis that it's performing is relevant to the objective. So interviewing patients, interviewing clinicians, what's important to you in this data, what can inform your decisions and empower you, and then making sure the AI is focused on that part of the information, and providing and prioritizing that piece.
I'm going to circle back to that in just a moment. I wanted to ask you, when you're designing an AI-enabled decision support tool for MS rehabilitation, given how wildly unpredictable and individualized MS symptoms can be, how do you train the system to replicate or enhance a human clinician's reasoning?
I think that is where the clinician in the loop and the patient in the loop strategies become key. So the AI it excels at ingesting large amounts of information and extracting key points. Is there an anomaly? Was there a change 2 weeks ago, a week ago? Is there a trend? But then to your point, to actually make that clinically actionable, to personalize it within the context of that individual patient's journey, that's where it becomes critical to have that patient and models where the AI is summarizing and synthesizing the data, but then it's clinical decision support, not clinical decision making, right? And so I think the patient and clinician model is really the key to that personalization.
I've heard you talk about the 6 domains of clinical decision support. Which of these domains do you think is most important or perhaps the most difficult to get right when managing progressive forms of MS?
So when you think about progressiveness and the large timescales in which data must be considered, one of the things that's going to be critical is creating care models that are predictive and proactive. And so getting data streams long periods of time and then creating predictive models that can then cue there might be a change in function, there might be disease progression, I think that piece, that's going to fall in the practice medicine domain. I think that piece may be a priority there, is using the AI to make medicine more proactive, predictive, and personal.
Traditional clinical metrics like EDSS or an occasional in-office walking test can only capture a brief snapshot of patient status. As you alluded to just a few minutes ago, people with MS can often experience significant day-to-day fluctuations in mobility, cognitive fatigue, and energy. Using wearable sensors, how can tailored remote monitoring systems capture some of these invisible symptoms like fatigue?
Absolutely. So you hit it on the head. We have phenomenal measurements in the clinic that can get very detailed, rigorous, quantitative information about an individual's status, their symptoms. But most of the time, that only applies to a snapshot of the here and now. As you point out, folks living with MS experience day-to-day mobility, across all symptoms: mobility, fatigue, depression, anxiety, sleep, etc. So, in-clinic measurements, they're incapable of capturing that variability, so it's difficult to detect the signal in the noise. When you have a measurement every 6 months, is that the signal or is that the noise?
Well, and how much does that even change whether that appointment is 9 o'clock in the morning or 4 o'clock in the afternoon?
Absolutely. The diurnal component too, not just day to day, but time of day, relationship to medications, lifestyle factors, absolutely. And so by getting that continuous data stream, you can then start to identify the signal in the noise. The other piece in the healthcare component too is it removes the burden of having to recall. Oh, you're experiencing increase in fatigue. When was that? 2 weeks ago, 3 days ago? Have you experienced decline in mobility? Well, so you're looking at burden on the patient to always recall and recall with such high stakes and accuracy. If you have the wearable data streaming, you have it automatically captured in one file, and then refer to it and have a data-driven discussion.
How do you ensure the wearable technology itself remains accessible and user-friendly for individuals who might be dealing with significant manual dexterity or visual challenges?
Yeah. So 2 things. One, this is, as I alluded to earlier, making technologies accessible, practical, able to integrate in workflows or usable through everyday life. That can only be achieved if we engage patients and clinicians early and often in the development process. We identify the problem, but then test the prototype iteratively. Identify the barriers, identify the accessibility challenges, refine the prototype. That way, by the time we get to a product that we're ready to test, it's already been informed and tested, and so it has a chance to be more accessible and valid in the real world. The other thing too is tailored solutions. As we know, MS affects has a cascading effect throughout the body. It affects multiple nervous systems with a wide range of different symptoms. And so also providing the sensing strategies that are relevant to that individual as well.
To your point, the Shepherd Center is famous for its unique culture where researchers are heavily integrated directly into clinical spaces rather than isolated in their lab. You hold knowledge translation meetings with both clinicians and people living with MS to design your studies from the ground up. Can you think of a specific piece of feedback or a barrier raised by a patient or physical therapist that might have changed how you approached a remote monitoring technology?
Oh, absolutely. Our entire line of research surrounding sensor-infused textiles, so smart socks, smart blue jerkers, that actually precipitated out of a knowledge translation discussion because traditionally our work had explored the application of wrist-worn wearables, which are extremely valuable in evaluating cardiac function, circadian rhythms, things like this. However, when it comes to activity, those measurements are measuring activity and steps at the wrist. So if someone is using an assistant device, such as bilateral trucking poles or later, limit upper extremity oscillations, and therefore their activity counts will not be reflected by that measurement that we capture. And so that discussion actually led us to explore other ways to more accurately quantify activity in folks who may be using assistive devices, which ultimately led us to our work around sensor-infused smart socks to evaluate gait and physical.
Well, you just solved the mystery for me. I wonder what the story was behind those smart socks, but boy, that makes so much sense. A major hurdle with home-based remote monitoring is long-term patient adherence once the initial novelty of a wearable device wears off. What strategies have you found effective for keeping patients engaged and tracking their data over long periods?
And traditionally, we have deployed a cadence of virtual check-ins, right? And so setting up kind of those synchronous telehealth discussions via, telecommunication, conferencing platform. However, this is a good opportunity, and that's effective. Having a conversation, how's it going? Are you wearing your device? Are there any challenges with it? Very effective. But I see this also as an opportunity. We talked earlier about patient permission being critical, especially in MSK, where it's very nuanced. However, in this case, I do see this as an opportunity for agentic AI, where there is not a patient or a clinician. We can have those automated reminders. It's like you have your wearable in 3 days. Hey, is the technology working? And then the agentic solution can actually troubleshoot that later as well based on using retrieval augmented generation, where the AI is referencing the user.
So you're bot being upon my bot.
Correct.
As you and I have talked about in the past conversations, we're in the very, very early stages of what's going to be a massive paradigm shift in how AI impacts healthcare. I looked a bit in crystal ball out, looked ahead 5 years. How do you envision AI changing the daily workflow of physical and occupational therapists who specialize in MSK?
Deeper understanding of what's going on inside the clinic. We have such important interactions that occur in the clinic with our therapist and our provider team. But again, it's difficult for patients to communicate how MS is impacting their everyday lives. And it's difficult for providers to understand that despite increasing emphasis on patient-doctor interaction, a deeper quantitative understanding. And some of these wearable sensors and some technologies, once we figure out the piece of ingesting it and making it interpret, summarizing it with AI, I think we're then again going to get to fully harness the power of remote sensing technologies, and clinicians are going to get such a better understanding of what is going on in each patient's everyday life, and the day changes, how it's impacting lifestyle activities, occupations, their vocations. So I think there really is the patient-clinician interaction is really going to start focusing more on what's going on at home. Treatments being able to be more tailored to achieving goals that are relevant outside the clinic, rather than standard clinical benchmarks, which is a kind of test.
Well, Dr. Brad Willingham, I want to thank you for the important work you do in ushering in the next generation of MS care. And I want to thank you so much for talking with me today.
Likewise, John. Thank you all for all you do for the community.